how much is social media and the isolation stuff happening in the last several years? How much of that impacts our mental wellness?
Well, we're social creatures, right? So we need connection and not just visual connection
Mhm.
or auditory. We need physical connection. We need to be we need to be in contact with each other or in close proximity to each other to really get all the benefits of social connection. So I do worry about many of us spending most of our time on connecting with people on screens. But I would also say that there is a silver lining to this where, people who live in isolated situations, or like during COVID lockdowns and things like that, or people who live in areas of the world where there just aren't a lot of people, or where they're not going to meet people that they have a lot in common with. So they're going to that can also be very dangerous for mental health. People feeling isolated and that they're not meeting people that they really have a lot in common with or can feel connected to. I think in those ways, social media can be actually very, very useful because you can find people that you have things in common with and feel connected to and feel less isolated, less alone. We are so much better informed and so much more empowered. And so ideas like carnivore diets, ketogenic diets, paleo diets, metabolic health, all of these really wonderful ideas, which are not coming from mainstream nutrition sources, not coming from our most prestigious institutions, not coming from our most influential scholars on this topic, not coming from our dietary guidelines. These excellent ideas, which are grounded in biology and logic and and anthropology and common sense, this dietary information can spread to people who need it, and that they can compare these ideas to these ideas that they've heard about for so many years and judge for themselves what makes the most sense to them, and they've got a real choice. Whereas before, it was very hard for most of us to access other types of ideas.
I asked my psychiatrist, who I was working with by that time 2 years, I just, for some reason, asked him, "Do you think diet has anything to do with why I'm sick?" And he looked up and said no. And so I said, okay. And I just sort of moved on. But why is diet not even a focus when if we were to go to the vet, the first thing they ask when the dog or cat is not well is what have they been eating or what have they been exposed to?
4 years of college biology degree, 4 years of college medical school, and then 4 years of medical school, 4 years of psychiatry residency. We didn't ever talk about the importance of nutrition to brain health, not once in all of that specialized education. So, of course, psychiatrists come out of their training thinking it doesn't matter because we're not taught that it matters. And the little bit that we do learn about nutrition, which is not about brain health, is about, weight management and cholesterol levels and heart disease, right? And almost all of that information is incorrect. But I think the good news is that the science in this field is rapidly exploding, and the word is getting out. And so I think there are some chinks in that armor, and that people are starting to see and hear about on, not just social media, but actually in reputable scientific journals and in reputable media outlets and from reputable sources that these interventions are really revolutionizing. They have the potential to revolutionize mental health care, and that it makes sense, and the biology of it makes sense. And I know this because I've been teaching this CME course in ketogenic diets for mental health for practitioners for more than 4 years now, and we are seeing a really dramatic rise in the interest in this course. People, psychiatrists, psychologists, nurse practitioners, physician assistants, social workers, psychologists, the interest in this field is really growing rapidly, faster than we can keep up with it. And so there's a lot of curiosity, a lot of interest, at least among a subset of practitioners. There will always be, with any new idea, you're going to see a bell curve, right? So you're going to see the early adopters who are really excited about it. And those are obviously the people who are contacting me about the course. And you're going to see the very conservative folks who are really resistant to any new idea of any kind, even if it makes a lot of sense. They did not, their minds are closed. This is a natural human bell curve. And then, but most people are in the middle somewhere where if they saw enough information, they'd be open to it. We're starting to move past this early adopter side of the bell curve, we're starting to see that more and more people in sort of the middle of this bell curve are thinking, wait a minute, what is this metabolic psychiatry? What ketogenic diets for serious mental illness? That's interesting. So we're starting to see more interest in it. And this is really wonderful because mental health practitioners know better than anybody else, we need new interventions. We have run out of ideas for how to help many of our patients. Most of us, I mean, and for myself, I know this is true, and for almost all my colleagues, our practices were filling up with people who just weren't getting that much better. And, medicine after medicine after medicine, years of psychotherapy, in and out of the hospital, with no real tests or explanations or understanding of what was wrong and how to help. And we now have, really just in the past 10 years, these powerful principles, science-based, evidence-based principles that go back over a century now, helping us understand that if you can improve brain metabolism by changing your diet and lifestyle, you can really fundamentally change your brain's operating system. And that gives everybody a tremendous amount of hope, because up until recently, we didn't know what else to do. And now we have these beautiful, empowering, relatively simple, non-toxic, natural interventions that can be life-changing and life-saving in so many cases. So why not explore those?